The coronavirus disease, commonly known as COVID-19, affected millions of lives around the world. The ADRA network, which is present in 118 countries across the globe, immediately responded to the pandemic during its outbreak in 2020. The ADRA network established a COVID-19 task force to combat the virus. It implemented 422 projects in 96 countries to serve 20 million people who were affected. Sri Lanka is one of the countries that was severely affected by the pandemic. In response to COVID-19, ADRA carried out several initiatives to support most vulnerable communities, the health sector, and frontliners. ADRA continues to fight the pandemic in Sri Lanka through the Building Resilience and Vaccine Awareness Project, also known as the BRAVE project. Through this project, ADRA supports the efforts of the health sector to mitigate the virus and raise awareness regarding the importance of COVID-19 vaccination among people.
Hello there. Good day to you and welcome to this week's BRAVE Roundup. The health sector of Sri Lanka played a pivotal role in successfully managing the COVID-19 situation. And today we are here to learn about how it was done. To shed light on this topic is Dr. Dilshan Ratnapala, the Additional Medical Officer of Health. Good day to you, Doctor.
Good day and thank you for inviting me.
To start this session, I would like to ask you as to who the main parties were in mitigating this situation.
Yes. Health Ministry of Sri Lanka plays a major role in mitigating COVID-19 pandemic in Sri Lanka. They prepare a national response and awareness plan according to the guidelines of the World Health Organizations. According to that, they prepare circulars and guidelines to the health staff in government sector and private sector to work according to that and adhere to the situation. And not only that, they also provide guidance to the general public and also give guidance to the other government and non-government institutions, hotels, factories and various other institutions to adhere to the situation and work according to that. And also, I also like to remind the staff of Health Ministry, including Honorable Minister of Health and the State Minister of Health, Health Secretary, Director General of Health Services, Deputy Directors of Health Services and other directors involved in the situation and consultant community physicians who did a marvelous job in national level coordination and prevention of COVID-19 situation. And not only that, we have excellent primary healthcare system comprising of curative healthcare sector and preventive healthcare sector. When we talk about the curative healthcare sector, it comprises of large number of healthcare institutions scattered all around the island, which are categorized as primary healthcare centers, secondary healthcare centers and tertiary healthcare centers. So they do a fantastic job in preventive life from the persons who are suffered from serious complication of COVID-19 situation. And I would like to remind their staff, including of hospital directors and medical doctors, nursing officers and matrons, nursing sisters and other paramedical staff and also healthcare assistants. They did critical job in saving life of due to the COVID-19 disease. And I also like to remind preventive healthcare system. Considering preventive healthcare system, we have excellent and world recognized preventive healthcare system comprising of 340 MOH units in all around the island. Each MOH unit is directly regulated by the Ministry of Health Sri Lanka through Provincial Director of Health Services and Regional Director of Health Services. Each MOH unit is led by the medical doctor with a special training of public health. And each MOH unit play a key role in managing COVID-19 pandemic at grassroots level. They organize PCR campaigns, they find positive patients and their contacts and quarantine them, and also they coordinate the admitting needy patients to the hospitals at the field level. And also finally, they did marvelous job by organizing a mass COVID-19 vaccine campaign and finally take over the control of the disease. So I would like to remind the staff of public health center, including consultant community physicians, medical officer of health, additional medical officer of health, and public health inspectors and public health midwife and their supervisory staff and office staff and also healthcare assistants. They did excellent job in preventing COVID-19 situation in field level.
Thank you for that comprehensive answer,
Yes.
Doctor. So, what are some of the challenges you faced in terms of resources and staff in dealing with the pandemic?
Yes, actually whole COVID-19 pandemic situation is a challenge for us. The big challenge faced to us is adapting to the situation, because it's a completely new situation of us. We hadn't had faced previous experience like this. So we have to adapt to the situation. We have to train ourselves. We have to refer the guidelines. We have to train our staff and empower those staff. So we have to work our normal working capacity, and we have to work beyond our boundaries, and also we have to forget our routine normal day-to-day life also. And most sensitive thing is we have to forget our separate from our loving ones in the family also. So it's a challenging situation. Another big challenge is we have to maintain our routine public health services as usual while dealing with COVID-19 situation. For example, we have to maintain uninterrupted maternal and child care services, EPI vaccination for children, and other school health activities, food safety activities, and also we have to prevent other diseases also, including dengue. So actually it's a big challenge. And also there's another challenge that even though our workload is increased by the 1,000-fold, but our staff is and resources was at same at that moment, and instead and also our staff also getting infected by day to day, and they were sent for quarantine with their contacts. So instead of increasing our staff, we have to face the troubleful situation with decreasing staff. That's a real trouble. And also we had to deal with various other government institutions, non-government institutions, community organizations, triforces and police personnels, and other civil organizations. Actually, they also had not a real idea about the situation. We have to train them also, and also we have to empower them and take the support for mitigating COVID-19 pandemic. These are the real challenges.
So then in that situation, how did the vaccine play a role? What sort of role did the vaccine play in mitigating?
Yes, in Sri Lanka we are using few types of COVID-19 vaccines, including AstraZeneca Covishield vaccine, Sinopharm vaccine, Pfizer Biotech vaccine, Moderna vaccine, and Sputnik V vaccines. Those vaccines contains antigens. These antigens act on different mechanism of the body and finally produce antibodies against SARS-CoV-2 virus. That SARS-CoV-2 virus is responsible for COVID-19 disease. And then if a person become fully vaccinated for SARS-CoV-2 virus, their body has adequate amount of antibody against that particular virus. So if that person infected from that virus, their antibodies can neutralize the activity of the virus. So there is less chance to produce disease for them. And if someone got from that disease, there are very less chance of getting complications of disease like COVID pneumonia and death. Due to that, number of caseload is reducing, and number of persons number of hospital admissions are also reducing, and then finally serious complications are reducing, and finally death rate also reducing. That's a mechanism that the vaccines mitigating preventing of COVID-19 situation.
Yes. But considering the sporadic outbreaks worldwide, Doctor, is there a potential for another outbreak? Is there a possibility of another outbreak in Sri Lanka, and how is our healthcare able to handle it?
Yes.
Are we prepared?
Yes. Actually, there's a possibility of another outbreak because the genome of the SARS-CoV-2 virus is changing due to the mutation by day, and they cause variants of this virus. For example, alpha variant, beta variant, gamma variant, delta variant, and finally Omicron are the examples for the future variants. And there's a possibility of emerging new variants of near future. If that new variant is more infectious and contagious, there are a high risk of getting another outbreak even though the people get vaccinated. Not as a healthy staff, not like previously, now we are well equipped with our knowledge, training, and also we have adequate resources. I think all the healthy staff in Sri Lanka are able to face another future outbreaks, and we are well prepared.
Thank you, Doctor. And to wrap up this session, I would like to ask you what you think in terms of the personal safety or the precautions people should continually follow. What is your advice to our viewers?
Yes, I have to say that COVID-19 pandemic is not completely defeated up to now. SARS-CoV-2 virus is still among us. So, as I mentioned earlier, there is a future possibility of another outbreak also. So, my message is, if you are not get vaccinated up to now, take your COVID-19 vaccination first dose and second dose from nearest MOH office, and also take your booster dose as the third dose from your nearest MOH office. This is the only way to prevent him from serious complication of COVID-19 disease and the death. And also I have to emphasize that we have to continuously practice our COVID-19 precautions guidelines, including wearing mask, keep physical distance, and maintain hand hygiene for furthermore periods.
Thank you, Doctor. And considering all these, the information that you have given us, we understand that you have a very busy schedule.
Yes.
So thank you for sparing your time and your day also for us. So viewers, I'm sure you learned quite a bit about how the situation was mitigated in Sri Lanka, but we are still not out of danger. So as the good doctor said, we should follow the preventive measures and the safety precautions and get yourselves vaccinated. Thank you and good day to you.